Welcome everybody to this roundtable discussion as I am joined here by my fellow providers and colleagues as we discuss diabetes. My name is Kashano and I am a hospitalist advanced practice provider, and I'll be discussing signs and symptoms both in the acute and post-acute care setting.
My name is Melody Kashimba. I'm the Vice President of Community Development and the Chief Patient Safety Advocate. I will be speaking today about lifestyle changes that help us empower the patient to empower themselves. Thank you.
My name is Gigi. I'm a registered nurse. I work in critical.
Hi friends, my name is Dr. Kashumba. I am an internal medicine physician. I am excited that we're having this discussion today. I believe that by empowering you, for you to understand what diabetes, it's going to make a world of
The Health, Education, and Literacy Network, where we're committed to heal. We'd like to welcome you and hope that you will enjoy it.
So many folks have been told that they have diabetes, but when I sit down and I ask them, you have been told you have diabetes, what does it actually mean? I have noticed that there is a gap. Today I want to fill that gap. I want to show you how marvelous this body is. I want to walk you through an analogy. You see how every single building is made of bricks or building blocks. Those building blocks are joined together to make buildings. The body is made in the same way, except instead of them being bricks, we call them cells. Me and you, we are made of cells that are joined together. The cells may look slightly different. Some of them, when we join them together, they look like our eyes. Some of them look like our skin. Take any part of your body. What it is this beautiful arrangement of cells that are put together. What's even more amazing is that each and every one of those cells is alive. It is living. Your job and my job is to feed each and every one of those cells. Can you imagine millions, billions of cells that you have? What a responsibility. The body has been made in a beautiful way. When we eat, we start to chew the food, it gets smaller. The goal is for the food to be the smallest size ever, so it can be fed into each and every one of those cells. We eat carbohydrates, potatoes, rice, pasta. Those are carbohydrates. When you start to chew them, they start to be broken down into the most simplest form, which is a sugar. So if I'm eating a potato, it's going to be broken down to sugar. That sugar must then be fed into each and every one of your building blocks. Again, the body, so wonderfully made, knows when you start to chew, it has this beautiful organ called the pancreas. What the pancreas does is it starts to make a substance called insulin. The insulin waits around for you to finish breaking down that potato into the smallest sugar. It comes, it hooks that sugar and deposits it into each and every one of your building blocks. The goal is for the sugar to get into the cell. But when the sugar does not get into the cell and it flows around in the pipes that carry all the blood through your body, and we check the blood in your pipes and it's high, that's diabetes. The blood sugar is high. It means your cells are starving. The sugar is stuck outside the cells. That is what is diabetes. This is why, as we shall discuss later on, some folks have to take a little bit of extra insulin, because that insulin will go and take that sugar and drop it into each and every one of your cells. So diabetes, uncontrolled blood sugar, is a state of starvation. Your building blocks are starving. I know nobody wants to starve themselves. This is why good control of diabetes starts by feeding yourself. moving that sugar into the cells. We will now talk more about
Thank you so
that.
much, Dr. Cash, for breaking down diabetes to the cellular level. So what am I as the patient going to see? What are the signs and symptoms am I going to see if I have diabetes? Hunger. You will have hunger because you are starving. Your cells are starving, so you will be hungry. Increased urination. Because of so much sugar in those pipes, your body wants to get rid of all that sugar. So guess what? You will be peeing a lot. Because you are starving and thirsty, you will be drinking a lot of water. So those three things, ladies and gentlemen, I want you to zero in on them. Increased hunger, increased thirst, and peeing a lot.
In order to treat diabetes, there are many ways of treating. The most important thing is for you to partner with your physician so that you can be able to take the right medication so that you can control your diabetes and have a productive life. The way diabetes is treated is you be given insulin. This is medication you have to inject yourself. You be given needles. These needles are very small, but that insulin is very important because that is the insulin which opens your cells so that the sugar can get into your cells and you can.
I recommend you're making this conscious decision to partner with us to better care for yourself. The last part of better caring for yourself is lifestyle changes. That includes a better choice of diet, that includes exercise, that includes making sure you take your blood sugar readings as ordered by your doctor to ensure you maintain good readings.
So this has been a presentation from the Health, Education, and Literacy Network, committed to community healing.